We're well, here's a report that's a little geeky, but I think it's important because it shows the effect of healthcare coverage about, now that 30 million people lost their jobs. Now, what are you going to do with healthcare, man? Because so many people now, get healthcare from their employer, and that's gone. Unless you do COBRA, that's a law that they have to keep your coverage, but you got to pay for it all. And COBRA, listen to this, COBRA could cost like $7,000 to $20,000 a year, for you to stay on COBRA. So this report, by the Kaiser Foundation or kff.org, I'll put all these websites. If you're watching this on YouTube, I'll put it in the description, all the things that I talk about. And one other thing, if you're on unemployment now too, this is interesting. Now you see the ways you could get health care is number one, Medicaid, because that's for low income, and that varies by state. So you have to check with your state. But interesting is that the extra $600 a week that you're getting from the Corona, grant program for the unemployed, that will not be counted as income to get on health care or Medicaid. So that's neat. It does for other stuff, but it won't for this. So that's interesting to know. Also, what's neat about it is that, to get on Medicaid too, immigrants, if you're here 5 years or more, then you could do it. You can apply for this. And the market plan, let's say you lost your job, special enrollment period. See, if you lost your job, if you go to healthcare.gov now, you'll know that only certain times of the year can you apply for health coverage on the Obamacare thing. But because of the crisis, or actually because of Medicaid, if you want to say you're eligible for Medicaid, you could apply all year long. So it doesn't matter. So if you're looking for health care and you think, oh, I got to wait till the December to apply. No, you go down now and try to apply, because also states are changing the requirement. The national level didn't. So there's some states that haven't changed, and you have to complain, and maybe you could apply to a normal program, not Medicaid. This will be a normal coverage program. But see, on the normal coverage program, what's interesting to me is that you could get up to $8,000 grant to pay for Medicare. Pay for your healthcare coverage. So like if you go to Obamacare or healthcare.gov, you could get up to $8,000 grant to pay for those things, to pay for your healthcare premiums. So that's a big chunk. Now that's a sliding scale, and it's all over, how many people you have in your family and what income you have. No, it's actually what you have now, not what you had last year. What income you're doing now. And they feel that there's 78 million are now in a family that lost their health care coverage. Okay, so we have 30 million people lost their jobs, and so they're making health care for other people in the household and things like that. So they also figure, there's this report from the Kaiser people, feel that there's about 30 million of that the 78 million. So there's 30 million people that are eligible now. These are new people who just lost their coverage. These 30 million people that just lost their coverage, about 12 million people are eligible for Medicaid, that is free health insurance, and about 8 million people are eligible for subsidies. So you have 30 million people lost their job, and so now that they're estimating that there's 20 million people can get free health care through Medicaid, and you could apply right now to do it, and go to healthcare.gov. And then the other thing is applying for an Obamacare program on the exchange. And about 8 million people are eligible for subsidies to pay for that. And that's the subsidies that could go up to $8 million, depending, 8,000, 8 million, that'd be nice. And so you get a subsidy of $8,000 to pay for that. So that's, now it's an important issue, because you have this virus going around, what's going to happen? If you get it, how are you going to pay for that? Well, they say the testing is really complicated. I'll do something later on that. But these are the programs. This is how many people involved. The 30 million people out there now are going to lose health insurance because they had it with their job. What do you do? Well, 12 million of those people can get it for free, and 8 million of those people could get subsidies up to $8,000. Now, here's another thing. Here's another article. I'll put the link in the page by the Commonwealth Fund. Now, they have this article on what to do. Did you lose your health care insurance because of the virus? Coverage options for laid off workers and others. Now, the Kaiser Foundation is a geeky thing. This tells you more about what's there. It's sort of like on COBRA, how that works. If you're uninsured, it says you basically have two options. If your monthly income falls below 138% of poverty level, and you live in one of the 36 states or DC that have expanded Medicaid, you're eligible for Medicaid, okay? And then it goes on to say that $600 a week you're going to get doesn't count. Okay, if your monthly income exceeds the amount, you're eligible for Medicaid. That makes you eligible. You may be able to get covered under the marketplace. Okay, so if you make too much money to be covered from Medicaid, you may be able to get coverage in the marketplace. Yeah. And that income on the marketplace goes up to $100,000. You're getting a subsidy. So you make up to $100,000, you get a subsidy to buy health insurance. Also, that subsidy goes up to $8,000. So the more money you're making, the less subsidy you get, and so on. So it goes on to more kind of issues that I think are interesting, particularly looking for healthcare. Now, another thing I think one of the best websites I found for healthcare on the internet is something called needymeds.org. I think they're really selling discount cards. They're not one of these, most of the stuff on there that tries to give free information and help are just full of crap. They have all kinds of stuff that they're selling and trying to get you to click on. This is really good research, and I plagiarize it from it all the time. Now, one of the things they have is that you can find out all the medical programs in your state. See, the state, a lot of states have prescription programs. They have all kinds of programs. You can put in your state here and find out. They usually have about 15 to 20 programs, everything from free breast cancer treatments and all kinds of stuff. So you could see that there, which is neat. Also, you could find low-cost dental clinics and medical clinics. And you could just put dental clinics, free and low-cost sliding scale clinics, and you put in your zip code and the like, and pop out it'll come. Okay, so here, why don't you put a state? I forgot what I did, dental or medical. And you just go down here. Okay, let's see what Illinois has. Okay, you put this in. Where is it? Oh, it's digesting. I don't even know how many. Okay, there's 700 programs. So these are 700 clinics in Illinois that have free or sliding scale health coverage, and the same for dental coverage. Now, the other thing is prescription drugs. You go to the, if you look at patient savings, have all the options here. One of them has prescription drugs, and there's a lot of programs at the state level, and some of the drug companies have programs and things like that. So to find that, and that's a really good website, needymeds.org. Okay. Look for that. And here's the sliding scale thing. How much money, how much subsidy you will get depending on income. Okay, here is a family of four making, say $40,000. You get $6,000 grant, to help you pay. Things like that. Okay, so that's what I'm trying to do in life, is show people the options, what's available. See, this kind of stuff isn't advertised, because you go on Google, all you're going to find is stuff that people want to get your money. The people that are selling you insurance, people that are selling you healthcare or whatever. And there's just a lot of good people, whether they're government or nonprofits that are providing services and even money for free. And we see now that during the corona, problem that we have $3 trillion, subsidies that are giving out already, and they're talking about 3 trillion more. So this is what happens, I guess. We have a problem. We're trying to come together and figure out the best way to solve this problem. Everybody has their own way, and that's why the confusion starts. But anyway, the stuff is real. It's out there. It's there to help. It's going to take effort. You don't make one phone call and get the check in the mail. People who have tried this now with the Corona program know that. So you're really in training, man. Your free money muscles are getting exercise, and what it takes to get this stuff, to get anything in life. That's worthwhile. It takes that. So we're going through good training, like the PPP and the unemployment stuff. They're still all screwed up trying to get this stuff. But that's life, man. Life is like we have this epidemic screwing us up. You got to build up resilience to that, because that's going to happen more than all I know is that I'm wrong 90% of the time. I've written 100 books and only 10 made money. So I have data that shows I'm wrong a lot. But I can show you free stuff, and that's what Let's Go Help is all about.